From the back to the front.
Wouldn't you, when you compress and you have pain in the SI, won't that refer to the front and the hip? So how do you tell?
SI joint pain usually will refer back down the back of the leg. If you're thinking about maybe lumbar discs or things like that, yeah, those can refer over, but that's going to tend to be produced more with flexion. But yeah, anything can happen. You're going to do these tests on people, and you're not going to get the classic things. You're not just going to get pain in the front of the thigh, or you're not going to just get pain in the SI joint. You might get things, you might have pain in the back that radiates down into that area. You know, patients don't follow textbooks, right? You're going to get all kinds of things, so you just have to be able to think it through and understand, okay, what's going on here? Am I compressing an inner tissue like a joint? Am I stretching a muscle? Am I impacting a nerve? How does the pain pathway, does it make sense anatomically? And then this one is just basically stretching the ligaments on the back here. We'll talk more specifically about those. You have the sacrotuberous. So sacrum meaning coming from the sacrum, and then ischial tuberosity, so you have one here. You also have the sacrospinous, this is the ischial spine. So basically you're just stretching that ligament is one thing. Are you also stretching other things or stressing other joints? Yeah. So it can also be an SI problem, sacrotuberous ligament problem. You could also stress something going on in the lower back. All right, then prone knee bending test. Basically, this is one that's where luckily the name pretty much tells you what the test is, right? Patient's prone, you're bending the knee. What you're doing is in this case, what we're talking about is looking for something in the lumbar spine, like a disc problem. It can also be an SI problem. You can accentuate that. Let's say if the patient's prone, you're bending the knee back like that. And you can also do sort of like that Gainsland's test, where if I pick up the back of if I pick up back like this, now I'm going to put more strain in that SI joint. And then that's what Eli's test is, where you're lifting that up and you're putting more strain into the SI joint. There's a couple other things that are going on that we'll talk more about when we get into hip, is that you can have a hip flexion contracture where if you go to bend the knee back like that and the hip tight flexes like that, there could be a problem where you have shortening of the hip flexor tissue. What you'll see in that case is you'll see flexion of the hip. So this angle right here will increase. And there's some other tests we'll get into for that when we do the hip. And then Trendelenburg's. So this side over here is the gluteus medius that's working when he raises up like that. So to hold myself up like this gluteus medius right here is contracting to pull me up like this. Okay? So what you're looking for is to drop down on the non-weight bearing side. Okay, so just think of it. Here's the gluteus medius. So we're looking for it to drop here, just like it is there. So this person's standing on the left side, and then that left gluteus medius is contracting to keep the right side of the pelvis up. So if I go up like this side's going to drop, this side's going to drop, but which gluteus medius is it? This one.
So you don't want it to drop.
Right. Yeah, you should be able to stay up like this without dropping the pelvis like that. And then here's our old friend, the Valsalva test again. Right. So now we talked about it in the neck. It can also apply to things into the low back because it's for intrathecal pressure. The thecal sac, which is the meninges in the CSF, when you bear down, it increases pressure all the way through. So it could be some kind of a tumor in the neck, it could be a disc herniation in the low back, anything. And then sitting root test. So now we're getting into what kind of test? Nerve. So how are we going to be stretching the nerves coming from the lower back? Are you going to do flexion or are you going to do extension? Flexion. So this is kind of like when we did before, we talked about Soda Hall kind of stuff and the remedies. Basically, I mean, here we're doing what? Flexion, stretching the nerves again here. So we talked before about you add this, add this, add this. So here you're just doing the straight, the basic part of it is just the sitting root part. Where all you're doing is just extending the leg. Okay, so then what can you do to accentuate that? The legs up like this. You dorsiflex the foot. What else? Flex the head. So basically you're still adding more pressure to that whole nerve. Just adding more stretch into the nerve. You add more stretch from this end. You add more stretch from the other end.
So are you actually extending the leg form, or they doing they do
Yeah.
it themselves? So you grab.
You do
It's a
it
passive.
yourself. Yeah, so it's a passive test. Yeah. This is another way, well, we'll talk more about the straight leg raising test, but there's tests that are called malingering tests. Have you heard of that? Basically what that is that you suspect that somebody is, for whatever reason, maybe financial gain, they're trying to accentuate their injuries. Okay, if I do a straight leg raise, and they're laying on their back and you raise your leg up, okay, and you get to here and they're like, oh my God. And then you distract them and you say, oh, what's this on the bottom of your shoe? Am I doing the same thing? So if that doesn't hurt, then you're thinking, well, maybe something's going on here. Okay, so here's a straight leg raise. Now the thing is that you'll see with the next picture, there's three different parts of it. Now here I'm going up to about 30 degrees. Okay, so 45 will be halfway up. That's when you're just getting started to put tension on the sciatic nerve. So you're going to maybe suspect getting pain once you get between the 30 and say 45 or so. That's where you can have the typical sciatic nerve irritation. Then once you get up into this point, you pretty much have stretched the sciatic nerve as far as it's going to get. If they don't get pain until you get up to here, then it's probably something else. It's more likely a joint problem. Okay? You can have a lumbar strain and your muscles in the low back are inflamed. Any kind of movement's going to flare it up. Okay? Sacroiliac, lumbar problems. If it doesn't start until you get to that point, you can pretty certain it's not sciatic nerve irritation. It's not like a lumbar nerve root or something like that. Because if they get it, they're going to feel it down here. When you first, about right there, they're going to start to feel it. If you have to go, if they don't feel it until you get up much higher than that, it's not likely that it's going to be nerve problems. Okay, the other thing is that they could feel it on the other leg. And it has to do with, when we talk more about disc herniations, if you have a medial versus a lateral disc herniation, you can have pain in the, and what we call this is a well leg raise. Okay? You're doing the same test. It's just different results. If you get pain in this leg, if the pain is in the well leg, then that's one type of problem versus if the pain is in the leg that you're raising up. That's the same thing. We're going to do a femoral nerve test, and then without knowing it, you're doing the cross-femoral nerve test at the same time. Because if you get pain, if you're pushing the leg back like this, if you get pain on the other side, that's called a cross-femoral nerve contraction test. It's the same test, just different interpretation of the results.